that we got 2 critical patients that were transferred from other facilities. How that's coordinated is that they would call our transfer center line and be connected immediately with the right type of specialist. In our case, we connect them with both a trauma surgeon and a burn surgeon who are both in on the phone call, and they receive a report from that physician that wishes to transfer the patient to us. They can make recommendations as far as medical care, and then also recommend the type of transport and how quickly and what type of level of care they'll need when they get here.
To what degree, for example, how does it determine when patients are in need of medical care, how they go to what hospital, or is that just more like the fire department?
No, there's actually regional routing by a group called Marker, which is Mid-America Regional Council, where health professionals such as ourselves get together annually and review with emergency medical services and public health the criteria for routing patients. We use the CDC triage guidelines as a basis for that, and so what we usually see in those guidelines is that burn patients are typically transported to the burn center for definitive care from the scene, and trauma patients go to the closest appropriate trauma center. In this case, because of the number of casualties and because of their severity of their nature, some of them were transported to other hospitals and then stabilized and then transferred to us at a later time. With the blast injury, one way that you can tell that a patient has been really close to a blast is by perforated eardrums, and many of our patients do have perforated eardrums, and so they were very close to that initial blast wave. So you can get injuries from a blast in a number of different ways. The first thing is the overpressure wave that travels through the patient and can actually damage air-filled things like their lungs and their eardrums. And then you have the second part is when debris flies across and hits the patient, so bricks, wood, all kinds of things hit the patient and cause those lacerations. And then the quaternary or third type of injury you can get from a blast is when the patient themselves is actually picked up and thrown across an area and usually impacts with something that brings them to rest. And we did see that very severe type of blast injury in some of our patients, so it was exactly like the injuries you would see in a bomb blast.